I'm John Hamilton. I've been a member of the Adult Division of Infectious Diseases since 1971 when I first came to Duke. I'm currently an emeritus professor of medicine. Duke's response to the HIV epidemic has been extraordinary, both because of the programs and events that were in place before HIV and AIDS was recognized. Building on those strengths, clinicians and researchers are now to the point of potentially creating a novel HIV vaccine. We want to share that story with the world.
The foundation for Duke's contribution and response to the AIDS epidemic started with its early diagnosis and management of tuberculosis prior to effective anti-TB therapies. Joseph Beard, Duke's first retrovirologist, who was recruited to the university in 1937, was Duke's initial champion of viral disease control and vaccine development. Duke's experience with solid organ transplantation and its first kidney transplant in 1965 helped doctors understand that immunosuppressing patients makes them vulnerable to opportunistic infections.
So that experience became incredibly important for the prototype of the immunocompromised host, which is AIDS.
An epidemic of hepatitis B in 108 Duke employees in the 1970s led to an understanding that viruses could exist in a person without making him sick, but indeed infectious to others. This incident showed why Duke and other healthcare providers needed stronger policies for handling bloodborne pathogens. In the summer of 1981, fear, angst, and desperation began spreading through the gay communities in San Francisco and New York as headlines screamed of rare diseases that were killing a large number of gay men. The AIDS epidemic continued to spread. Friends, families, lovers, and caregivers of people suffering from this deadly disease clamored for answers. That frustration, lack of clarity, and a sense of helplessness played out dramatically with activists. The first patients at Duke and the VA with GRID, gay-related immune deficiency, showed up in 1982.
There was quite a bit of fear, even in the healthcare provider community. And what we saw was that some healthcare providers were quite terrified to take care of patients. So patients became isolated socially.
When they came into that clinic, it was the only place where someone really held their hand or hugged them. And even though it's not something we normally do as medical care providers, hugging patients, it was such an important part of the care that we provided because no one else would touch them as if they were lepers.
Researchers around the world felt the pressure from patients, from doctors, from activists, and from governments to figure out what was causing this dreadful disease. Then in 1983, French virologist Luc Montagnier and American biomedical researcher Bob Gallo both isolated HIV, which became known as the infectious agent that causes AIDS. Dr. Barton Haynes, a Duke T-cell biologist, began working with Gallo and contributing to the efforts at the NIH to isolate HIV.
I saw this individual and saw these skin lesions, and they looked a lot like what Gallo had described in his individual from whom he'd isolated this virus. And so I called Dr. Gallo and I said, I think I have a patient with Japanese T-cell leukemia, which is the same virus that you think is the virus that you've isolated. And he immediately sent me all the reagents, and we took this patient's cells and put them in culture, and lo and behold, there appeared the virus. And it was the first isolation in the United States after Bob Gallo's and some of the Japanese work as well. And this kind of virus is called a retrovirus. It's an RNA virus. It's the kind of virus that a few months later, when the AIDS epidemic hit, the immediate suspicion was that, well, maybe the AIDS virus could be a retrovirus or an RNA virus as well.
just as precautions in the operating room around people that had viral infection improved the process in the operating room, caring for a group of patients that had a very vocal advocacy group improved how we take care of almost every disease. And the lessons that we learned from the AIDS epidemic made us all better doctors. It put in the lexicon phrases that allowed us to maintain that all of our patients were human. I really think that approach to humanity in surgery was made possible, or at least was accelerated, by our approach to AIDS and our approach to dealing with HIV patients, where we had to be immersed in those patients, despite the fact that we knew that there was a risk involved.
That's just a glimpse of what Duke's contributions have been in response to the AIDS epidemic, but there is so much more to the story.
A comprehensive documentary will feature dozens of on-camera interviews, archival images, and historical footage. A high-profile spokesperson narrator will guide viewers through a program that showcases Duke's doctors, nurses, researchers, and staff who have and are tirelessly caring for North Carolinians and thousands of people around the world who have AIDS, TB, and other infectious diseases. The program will humanize these deadly diseases by introducing real patients and caregivers, highlight Duke's ongoing efforts in AIDS and TB research and vaccine development for improved health and increased access to quality care here in North Carolina and globally.
The documentary will promote awareness and prevention of infectious diseases and highlight Duke's academic excellence and educational access for future success. This novel documentary would be invaluable for the Duke archives. We ask for full funding so as to complete this project. Thank you for your consideration.